name is Pat Spencer. I am in private practice in Highland Park, New Jersey. And I'm also the secretary on the board of the New Jersey chapter of NASW. Today we're going to be talking about telehealth. Also joining us is going to be Jennifer Thompson, the executive director of the New Jersey chapter. And I believe Christina Mina will also be joining us. Hi, Jen. So I think today we want to start off by talking. Actually, Jen, did you want to jump in and say anything?
Yeah, just wanted to welcome everyone to the conversation. We are excited to have you all. And just as a little bit of a disclaimer, we know that we have people on joining from across the country. So we're going to be providing a lot of information to you, but some of it will be New Jersey specific. So as questions come in, just keep in mind that we'll try to make note when there are state specific laws and things to be on the lookout for. But a lot of the information will be helpful to everyone here. So welcome, and we look forward to this conversation. It's certainly timely.
Mm-hmm. And I believe today, if anybody has any questions, they just enter them in the chat box, Jen?
Yep, absolutely, and Annie will be moderating.
All right, awesome. All right, so is it okay if I start? All right, great. So I am on this panel today talking about kind of the private practitioner view of this whole situation, of what we've been going through over the past 2 weeks. And I'm going to assume that I'm not alone in that there has been an awful lot of confusion and a lot of questions that have come up. I've seen it among my colleagues here in my building, but also in various groups that I belong to, as well as the own questions that I've come up with. You know, when coronavirus first kind of hit our area, we were all kind of scrambling, figuring out what do we do? How do we keep providing services to our clients? Because quite honestly, we do want to provide quality services. We do want to serve those that we are serving. We want to be able to be there for them. Yet we also want to be there for ourselves. We want to be there for our families. We want to stay safe. We want to keep our clients safe. And then came various shutdowns. Schools were shut down. Businesses were shut down. We were asked to socially distance ourselves. And now all of a sudden, therapists across the state are trying to figure out, well, my kid is home. I can't necessarily go to my office right now, so how do I provide services? So now we came into doing telehealth. And telehealth has been available for a while, but a lot of us were kind of thrown into figuring this out in a very, very short period of time. So some of the considerations I had when I was deciding if I'm going to do telehealth or not. One consideration I had was, if I do telehealth, how do I get paid? Was one question actually that I had. How do I get paid? Will the insurance companies that I'm in network with, will they reimburse me? And boy, there was a great deal of confusion about that for a while. And at this point, it seems that, yes, the health insurance companies are going to be paying us. Again, there are various questions about, are they going to, what codes do we use, which I believe Christina will be talking to us about in a little bit. Are they going to pay us in a timely manner? That's another question. And quite honestly, I don't know if we necessarily have those answers, because those are insurance companies that have to come up with those answers. There was a big question about Medicaid reimbursement, because I know a number of us provide services to those on Medicaid. I myself, I don't currently do it, but I am authorized to do in-home services, IIC care, where I am a Medicaid provider. But it wasn't until late last week, and I actually want to say Friday of last week, that Medicaid, it was approved for us to provide services via Medicaid. Now, there still are questions about billing, about billable codes. And again, those are going to have to be answered by the insurance companies, and it's possible that Christina has some information on that for us. So one of the concerns that I had when first deciding to do telehealth, again, was just how do I get paid? And what I came up with myself for my own philosophy was, I'm going to provide services in as safe of a manner as possible for my clients. So for a while, I mean, quite honestly, up until late last week, I was providing services in my office. And what I was doing in my office was wiping everything down 3 to 4 times a day with Lysol wipes. Thankfully, I had some. I went shopping before the whole pandemic. And actually, at the suggestion of a colleague, I actually ended up getting hand sanitizer like 4 weeks ago. So I have like 65 ounces of hand sanitizer at this point. So between each client, I wipe the office down. I wipe all the doorknobs down. What I was doing when I was still seeing clients was I would open and shut the doors. So therefore it's only me that's touching the doors. And I would just do as best as I could. Once the coronavirus started growing, I had very real conversations with my clients. And we started these conversations a few weeks ago about what it would be like to move to telehealth. Is this something they would want? Is this something they would not want? For some of my clients, it was something they did want. So it was pretty easy to transition them. For others, it was something they don't want. And for those, a lot of those are folks that have maybe struggled with getting out of their house. Maybe they feel a little bit socially isolated. And so we've been working on getting them more socially engaged. For some, they live in a very small setting and they quite honestly want time away from their family, which I'm guessing nobody out there understands what that's like to want to have some space. For some, they're in situations where maybe their partner has been abusive towards them. So then I have some very real safety concerns about when and if to provide telehealth services to somebody in a domestic violence type of situation. So again, we started discussing this a few weeks ago. I left a lot of it up to my clients as to what they would want to do. But then as of last week, I decided that I was no longer going to provide office-based services. So my last office-based service was on Friday to one client, and to everybody else has been online since then. I then had to look at which telehealth platform would I be using. So yes, the OCR, the Office of Civil Rights, I believe, through Department of Health and Human Services, has said that it's okay that we use platforms that are not HIPAA compliant. Again, for myself, I made the decision that I only wanted to use a platform that was HIPAA compliant. I wanted to make sure my clients do get a chance to maintain their privacy and confidentiality as much as possible. I also chose to use a platform that is HIPAA compliant because, well, I believe the insurance companies are requiring it, and I want to make sure I'm still following along with their guidelines. And finally, it's also my malpractice insurance. I believe my malpractice insurance requires that if I provide telehealth, that it be on a HIPAA compliant platform. So for me, the decision that was right for me was to use a HIPAA compliant platform. I'm not in any way recommending one or the other, but some of the HIPAA compliant platforms that are out there are Theranest, DoxyMe, I believe Zoom is HIPAA compliant. I believe VC, and there's a number of others as well. I believe Microsoft Teams can also be HIPAA compliant. And I think in a little while, Jen's going to talk about some of the HIPAA compliance stuff as well as the BAAs that would have to be signed for that to occur. But again, for me, the right decision was a HIPAA compliant platform. So overall, when I'm considering doing telehealth, I'm looking at three main factors, and these three main factors overlap. The first main factor is the therapist. The second main factor is the client, and the third main factor is the location. So with the therapist, some of the factors I'm going to consider is the therapist competent in providing telehealth? I do actually clinically supervise some folks, so I would be considering, are they competent in providing telehealth services? So with that competence is, are they comfortable with technology? Do they have access to the technology? Would be another thing to look at. So comfort, I'm sorry, I just totally lost my train of thought, but comfort, do they have access to technology? Do they have access to a quiet space? Are they using therapeutic modalities that are easily translated to telehealth? So some concerns I've heard in the various communities I belong to are what to do with children. I do actually clinically supervise some young clinicians, young in experience, they're LSWs, that they work with children. So with them, what we've talked about is that some of the telehealth might not be appropriate for the child themselves every single time, especially the younger kids, but that they would hopefully be doing a lot of interacting with the parents. So maybe using the parent as the therapist. So helping the parent develop the tools to maybe help regulate the child. which ideally is what I'm hoping we're doing anyways as therapists when working with children, regardless of young children or older children, but how do parents help regulate the child? And how do they help kind of stave off any emergencies? So that would be one thing I'd look at is, are we able to provide those services? So doing sand tray therapy, for example, with children, probably not very easily translated to telehealth, unless that family happens to have a sand tray or happens to have like a sandbox or something that we can then potentially use. This is where the therapist gets a chance to be really creative and tap into that. There are lots of really great resources out there. Just simply Google, like, play therapy, telehealth, and you can come up with an awful lot of potential resources. So that's a therapist. Those are some of the considerations with the therapist. With the client, I'm looking at what are their considerations. One of the very first considerations is, are they clinically appropriate for telehealth? So if I'm working with somebody who's in a domestic violence situation, he or she might not be appropriate for telehealth if we're doing like some deep oriented, insight oriented type of therapy. Maybe it would be appropriate if all we're doing is kind of some coping skills and kind of treading very lightly. And also if that person can potentially get to somewhere else where the person who is abusing them is not around. Because let's remember that, as the saying goes, walls have ears, the walls have ears. So I'd want to make sure that they're in a setting that is as safe as possible. Another thing with the client is I need to know where they are located. A situation that I've run into very recently, actually, is I practice, like I said, in Highland Park, outside the campus of Rutgers University. I have a number of clients that are college students or graduate students, and a few of whom live out of state. So while they're here at Rutgers, they come to my office and I provide them services in my office because I'm licensed in the state of New Jersey. However, they're returning home to other states. The two states in particular that my clients are from are Connecticut and New York. I am not licensed in Connecticut or New York. And one of the things I have to consider is how to provide them services. So I reached out to the Connecticut NASW as well as the New York State NASW and was given two very different answers. Connecticut is allowing anybody that's clinically licensed in one state to essentially provide telehealth services in their state without having to get licensed until late May. I think May 21st is what I heard. New York State, on the other hand, is not allowing people to provide services that are licensed in other states. And I just heard that this morning. So with that, I have a choice of either do I try to get licensed in the state of New York or do I try to link my client up with another therapist? And that will be a conversation that client and I are going to have to talk about. So that's some of the questions with the clients. And then the last consideration I think about is location. So where am I located, but also where is the client located? Again, there's the state rules and regulations, which I get, but there's also our physical surroundings. So you, as a therapist, we still have to maintain the same levels of privacy and confidentiality as we do in our office. And at times that is awfully hard at home. Especially, yes, Jen, I see you raising your hand, especially if you have smaller kids. Smaller kids have a hard time understanding that mommy or daddy needs to work right now. And they have a harder time not coming in the room. But if you're able to do it, great. If not, you do as best as you can. So we want to, so I actually come to my office. I come to my office because for me, this is where I work. I have a hard time focusing in other locations. So this is my workplace. I also have privacy. I have confidentiality. I have a secured router and modem and internet and all that good stuff. And I'm also the only one online through my internet here in my office. Because at home, if somebody's at home and everybody is using the internet, maybe the kids are playing, they're streaming some video games, maybe a spouse is streaming some Netflix and you're doing therapy, that takes an awful lot of bandwidth. So one of our considerations is our bandwidth. Is our internet able to handle that? So again, you want the privacy, you want the confidentiality, you need the access to the internet, you need the bandwidth to the internet as well. For the client, I also, again, I was talking about this with them over the past few weeks, is are they able to do therapy safely at home? If they're not able to do it at home, we brainstorm some other ideas. I've met with people this week sitting in their cars. I did ask them to please make sure they're not driving their cars, that they are parked somewhere, which they were, thankfully. So again, we want their privacy, their confidentiality. Some of our clients do not have access to the internet. Some of our clients do not have access to Wi-Fi. But I've also heard that a number of the internet providers are providing free Wi-Fi to some folks during this time. So that might be a consideration for some of the clients to look into. Most of our clients, though, do have access to smartphones. Again, I do know that there are some that do not, but a majority of our clients do have access to smartphones. So they should be able to do it on their phones somehow. If they're not able to, then it's, quite honestly, it's possible that they might not be eligible for telehealth services. And for those that are not eligible for telehealth services, you as the therapist are going to have to decide, is this somebody that I still need to see in person? And if I do, how do we do it safely? Or is this somebody that we can not treat until coronavirus is over? Or is it somebody that maybe you can do some telephone check-ins with for a few minutes here and there? Some of the things about telephone check-ins, though, is that most of the insurance companies, from what I've read, and again, I'm not an insurance expert, but from what I've read, most of the insurance companies require synchronous video conferencing to be provided in order to get reimbursed. So if you're simply talking on the phone, that is not synchronous video conferencing. That is telephone. Synchronous video conferencing means at the same time having a video conference, and much as I'm doing right now. So those are some of the concerns with the location. I'd also been asked about informed consent. So the gold star standard is to get written consent. Ideally, again, the gold star standard is to get written consent where you hand the client a piece of paper, you go over the consent with them, you go over the risks, you go over the benefits, you go over any potential costs that might come up, and you have the client sign that form. Some of the risks of internet online therapy is that what happens if the internet goes down? What happens if there's buffering, which happens often? What happens if you lose connection? So those are some of the concerns. But the benefits are that we get to keep seeing each other and keep treating each other. So again, the gold star standard is that written consent. However, some of us were thrown into this without being able to get that written consent. So the next level down is some type of written consent, but done electronically. Whether it be an email sent to the client with the informed consent out in the email, and the client emails you back, yes, I'm okay with this. Again, not the gold star standard, not what we're actually looking for, but kind of do the best you can. Another option could be emailing the client a document that they print up, they sign, take a picture of it, and send it back to you. So now you have a picture and potentially convert it to a PDF. That could be another option. And then the final option is mainly just verbal consent and then documented throughout the record. However, that one, I would use that as the dead last one, and really work more towards getting actual written consent at some level with the client. Let me see. Jen, did I capture everything? Can't hear you, Jen.
Hi, sorry, Annie had to unmute me. Yeah, I think that's a really great
overview of how to start doing telehealth. And I think one of the great things that you've mentioned is environment and making sure that you have one. So you'll see my child popping up in the background, and that's a fun time. We're also homeschooling in our house. So I think maybe if it would be okay, I'd like to just jump in and talk about some more of the tech considerations. I know you spoke about them a little bit, and then we will have some questions, I'm sure. I see a lot of them coming through our Q&A box. So some of the things that we want to do in terms of tech consideration is an environmental landscape. And I know that you talked about it from, practicing from your home office, but we also really want to think about for those practitioners who are going into small offices, et cetera, that might be sharing co-spaces with other people, really making sure that the internet is secure, that you have firewalls in place that are appropriate. I'm sorry, folks, I got a child speaking in the background. Give me 1 second. It's a reality now. It's just a reality. He's 7. So making sure that you have a safe space and your technology is secured. For example, my house is a really great example of one that is probably not appropriate to provide telehealth services. Also making sure that your practice office spaces have the technology secure. And we can offer connections to a company who can help you answer some of those questions that you might have. I know a lot of practitioners who go into private practice we don't have the skill set to do an IT assessment and understand what things we should be asking. So we can provide that to you, and we'll do that as a resource on our website. Technology at home is really important. Making sure that you have secured internet, secured sharing of documents, or storage of your documents, making sure that you have that set up. Other things, we had a couple of questions come in about like platforms, things that you can use. And I know that you mentioned a few of them. One that we did want to bring up because it was specifically asked about was that of RingCentral. It is the platform that we're using right now, and it is a really great tool for people. And one of the things that came up in our last webinar or conversation last week was if people aren't comfortable transitioning and have questions about how do we text our clients, how do we communicate via fax, how are we doing all of those things, we need HIPAA compliant software all around. And RingCentral is one of those integrated systems that does allow, sorry, it just is. I know, I see it in the background. Someday this will go away. Those integrated systems that has text, fax, and webinar component with your clients. And so for those who had questions about RingCentral and why it wasn't listed on the website, we'll make sure that it's up there today and we can connect you with a vendor. And a lot of these companies are also providing these services for free now, HIPAA compliant software. And we know that there's some guidance out there that says that you can use non-HIPAA compliant software, but I thought you brought up a really good number of great points. Just because you can doesn't mean you should. And certainly our guidance is to make sure that you are still checking off all of those necessary boxes in terms of compliance with your malpractice insurance, compliance with Medicaid, Medicare, insurance companies, make sure that you're doing and you're using the correct platforms. Between last week and this week, we have gotten a number of questions about insurance companies requiring that you use specific platforms as well. And I don't know if that's something you have any experience with or have you heard about?
I have heard about it. I know that I'm in network with Horizon Blue Cross Blue Shield, and they are one of the ones that's saying that they want people to use their platform. Those guidelines, I believe, are for when things are normal, not during our pandemic. Over the past few days, actually, there's been a number of updates with Blue Cross Blue Shield. And my understanding of the most recent update is that, yes, we can meet with clients on our own platforms. I do believe it still has to be HIPAA secure. I'm not 100% confident on that particular point, but it's something I strive for. I do not think we have to use their platform from my understanding of what has been sent out to the practitioners. And so I've had some families, some of my clients that called Blue Cross Blue Shield. One day they were told, yes, they need to use the platform, the next day they're told, no, I can do it. So it is kind of always fluctuating, always in change, always changing, sorry. And that really all we can do is the best that we can do in this moment. And you know, I was jokingly telling somebody today that quite honestly, by the time we end this webinar, the information we're giving will have already been outdated. So just, again, do the best that you can. But my understanding, again, with Blue Cross Blue Shield specifically, is that we can do it on the platforms that we are using.
Oh, there you go, Annie. Annie's in charge of our muting and unmuting. So we're going to provide a lot of the resources in terms of technology, but they're on our website, but there are a lot of open questions that are coming through. And I want to make sure, last week we had over 1,000 questions that came through, and I want to make sure that we're able to answer a bit more of those. Annie, do you want to jump in and start to read some of those? I know some of them will be about billing for Christina to step in, and then also questions for Pat and perhaps myself.
Sure. So one of the questions I think you can probably answer, Jen, is someone had a question about what NASW is doing to advocate for individuals who are trying to get telephone sessions covered under Medicare. You know, a lot of people are uncomfortable with going on camera or just, you know, are on the wrong side of the technology divide.
So this is an ever-changing situation. We are working on a national level to do advocacy to allow for that. And right now, there is an expansion to telephone therapy as well. Christina, do you want to jump in and talk a little bit about some of those changes? I know you were looking up codes, and there are some special considerations when talking about providing services via telephone. Is that correct?
Yes, as far as we know, Medicare is still not allowing for telephone-only sessions to be reimbursed. And as Jen said, this is something that we're trying to advocate for on a national level. But CMS has come out with several statements, most recently the one from last week, stating that although they have lifted their HIPAA rules for using HIPAA-compliant platforms, so they now are allowing FaceTime and Skype, for example, they're still not going to reimburse for phone-to-phone sessions only.
Some of the other questions, so I've had questions about one of them, what is the most beneficial way to provide services for students in a school setting?
I can potentially answer that one. Somebody else I clinically supervise is a social worker in a school setting. There is no one particular way that's best to do it. There's going to be several considerations. Number one is if you're a school social worker trying to provide those services, you have to work in whatever the confines are that the school is allowing. I have heard of some school districts are trying to come up with different platforms where they can still do this. There are several students throughout the state that have IEPs that mandate counseling. So some of the schools are trying to figure out how to do that. So a lot of that's going to be up to the school district and what platforms they're going to use and how they're going to provide those services. And again, there's several questions that would come up, you know, such as does the student have access to telehealth or any type of telephonic services? Some of the schools are using online platforms for education. So they would be like, for example, Google Classroom, Genesis, and I forget the others that are out there that the schools are using that might be able to help out. You know, if you're an outpatient therapist like myself working with students, one of the biggest topics, the two biggest topics I've seen for students, and again, this is my experience of what I've seen in my office, the two biggest things are coping with the lack of structure, and now kind of a lot of the education is self-directed, and that has been a struggle for some. For some of my clients, it's about they actually are extremely motivated and have a hard time stopping the work, and others are at the other end of the continuum where they have a hard time starting the work. So I do a lot of work with the parents on how do we set up some type of structure, whether it be structure of starting times and where are they going to work in the house and how are they going to do it, but also structure on when's the ending time and how do we still have fun and engage in other activities. So the structure is one big area. The other area that I'm hearing a lot about is the interaction with other peers, with other students. For some students, staying home has been a godsend. School was torture for them. They were teased, they were made fun of, they were bullied, they just never felt comfortable. And now being home is just what they've been wanting and are just thriving. Meanwhile, I have other students that are like, I'm totally alone. And so we're working on how to keep them engaged and connected to their friends in the area, whether it be through social media or FaceTime or online platforms, but how to keep them engaged. So those are the big areas that I work on with kids that are in school. So I hope that answered the question.
I had one question about if people are allowed to accept copays at this point, with a lot of the insurance companies waiving the copays.
Great question. And it's one that I don't actually have an answer to. What I've done with my clients is I've seen that we're like Horizon Blue Cross is like they're saying that they're going to pay the whole thing and they're not doing cost sharing. So with the clients I work with, I let them know that I'm going to bill the insurance company. I'm going to see what they pay me. If they covered the copay, that's wonderful. If they don't cover the copay, then I'm going to collect it at that point. The other option is to collect the copay, but then potentially have to reimburse the client on the other end if the insurance company does pay the copay. And for me, I would rather not owe people money. So that's kind of the way I'm handling it. Again, you can check with the insurance companies about if they're going to pay the copay. And I know right now everybody's yelling, please don't tell me to check with the insurance companies. We're going to be on hold for hours. Unfortunately, that is correct. It's the insurance companies right now are just overwhelmed and are not able to handle the call volume. So again, just for myself, what I've decided is I'm not collecting the copays for my Blue Cross Blue Shield clients, with the understanding that down the road and within the next few weeks, I could be collecting a lump of copays from them. But we also have this discussion with the clients of if their copay is $10 or $15, most of my clients are okay if they pay it down the road. I have a few clients with much higher copays, and they're like, no, I'd much rather pay you now, and if you owe me money, then so be it. So that's also part of the conversation. But a lot of this is about the conversation with the client and how to have it be as fair and equitable to everybody. There any other questions, Annie?
Yep, just reading through some to see. Is it true that some malpractice insurance policies may not cover services not provided in the office, like in a home office?
You would have to read your insurance policy to determine that. Everybody's going to be choosing something different for their insurance policies. So I can't make a blanket statement of yes or no.
Hi, I think a lot of the questions are people, if we could just get some clarity about Medicare and Medicaid, maybe Christina, if you have any information, especially about modifiers. I think there's some questions about billing and coding. So I will say to everybody that we have an abundance of resources on our COVID-19 FAQ and resource page, in terms of examples of the informed consent and HIPAA compliant softwares, if everybody wants to check there as well. And I'm sure we'll send a follow-up email with information on that. But Christine, I'll unmute you if you want to go over some modifier stuff.
Hey, Christine.
Okay, can you hear me?
Yes.
Okay. So I know there's been a lot of questions. I've been trying to answer a lot of questions as Pat's been through the Q&A box. So just keep posting your questions and we'll try to address them. And I know Jeff is hopping on to answer questions as well. So just bear with us. We still have about a lot of questions left. But to answer the question about Medicare CMS. So as I said earlier, as we know, the place of service code is 02, and that is for telehealth, which is different from the typical office visit code of 11. And Medicare is not requiring a modifier. So some other insurance companies are requiring either GT or 95 as a modifier. But for Medicare specifically, they are not requiring a modifier. Place of service code is 02. And as far as we know, again, phone calls are not a reimbursable expense. Just while I'm on, because I know there's been a ton of questions about other insurance companies. We know the top 3 in New Jersey, obviously, are Aetna, Blue Cross and Blue Shield, and Cigna. Here's what I can say. And I know nobody wants to hear this, and I apologize that we don't have a better answer, but it's really up to the providers to double check with their insurance companies directly to find out what is being covered. We have not heard any official statements from the insurance companies directly about specifically phone calls, whether or not phone session only sessions would be reimbursable. We have heard, even just right now in the chat box, people are saying that Blue Cross and Blue Shield has said that they will do, that they will cover phone calls. We've also heard that from Cigna and Aetna.
Mm-hmm.
That is heard. So please, you have to double check, because at the end of the day, we understand, as Pat has been saying, continuity of care is extremely important, but we also know you want to get paid. And so if you want to get reimbursed for the time that you're spending with your clients and you're trying to bill it as 02, you have to make sure that it meets the standards for what these insurance companies are considering telehealth. So I just wanted to make that point. I'm just looking at my notes to see if there was anything else. Oh, another thing I just wanted to briefly mention again, because I'm looking at a lot of the questions, is the licensing requirements. So as you all know, New Jersey, just as of Friday, Bannon is allowing now for temporary or provisional licenses for out-of-state practitioners to practice here in the state of New Jersey. We know that that was something that we've been waiting on for a long time. This came through the Office of the Attorney General and the Division of Consumer Affairs, that they're going to be allowing. There's a link on the Division of Consumer Affairs website, which we have sent out to our distribution list. We'll also have that available on our resource page for people to apply for expedited licensure, and that's for healthcare providers, including licensed social workers from out of state. The question now, other states, as Pat was saying, she heard from Connecticut one thing and then New York something completely different. We have heard, again, from other people that Pennsylvania is offering temporary licenses. New York is not. This is changing, again, very quickly. And so you do have to check with the licensing boards directly. If you are an NASW member, you can contact the state chapter of that state and find out what their licensing, just like we're familiar with New Jersey's laws, you know, that state chapter's staff might be familiar with their licensing laws.
Mm-hmm. Christina, can I jump in for a second about Blue Cross Blue Shield?
Yes, of course.
So I pulled up an email I got yesterday from Blue Cross Blue Shield, and it's on their website, the Horizon Health News, and just something about reimbursement. So it says, providing reimbursement uniformity to in-network physicians for services rendered via telemedicine. When conducted according to the standards for telemedicine established by New Jersey statute, blah, 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 in-network health professionals can submit claims for all CPT codes associated with office visits, along with a modifier noting that the service was provided remotely via telemedicine in order to fully be reimbursed at the same negotiated rate as an office visit. So for those that are in network specifically with Horizon Blue Cross Blue Shield, we have to use the modifier, and I believe the modifier is 9.5. So you would do like 90837, and then in the modifier section 9.5. We would then get reimbursed at the same rate, which is good to know. And actually, I sent this link out to a number of my clients yesterday who were confused about what was and wasn't allowed.
Thank you.
Mm-hmm.
There's also been a lot of questions about out-of-network reimbursement, and I don't know, Pat, if you have information about that.
I don't.
Okay. So we have heard various different things from out-of-network policies not covering telehealth. At this point, our recommendation is to have your clients inquire directly about their own out-of-network benefits to find out whether or not telehealth is a covered service within their plan. We, again, understand how awful this might be because we can't expect our clients to just terminate and then go to an in-network provider. And so we are, again, working with the insurance companies to get clarification and some equity around this. But as of right now, best practice is to have your client reach out directly to the insurance companies to find out whether or not the telehealth services are included in their out-of-network benefits.
So,
no, I was just going to say, there's been also a couple of questions at this point around whether or not psychotherapists are still allowed to see clients in their private practices. And I know, Pat, you made the decision, and it was a personal decision to stop seeing clients. But as a reminder, based on what the governor, the stay-at-home order, clinical social workers are still considered essential, and of course, to our clients. And so if it's a personal decision, you can keep your offices open as long as you follow CDC regulations and take precautions with your clients and cleaning the spaces. But you do not have to close your doors if you don't want to, and if that's not what is suitable for you and your clients, as Pat was discussing. That is a decision that has to be made between you and your clients based on all the things that Pat mentioned. But telehealth is certainly encouraged if possible and if reimbursable.
right. And I'm just going to jump in one more time. Sorry, Christina, you keep reminding me of things. Just one of the reasons I did decide to do telehealth only is because in the, hopefully, fingers crossed, unlikely event that I get sick with coronavirus or COVID-19, I would have to then notify everybody that I've had contact with over the past 2 weeks, and or let other people know who I've had contact with over the past 2 weeks. And I don't want to put my clients at that risk, and I don't want them at risk for getting sick, but I don't want to breach their privacy or confidentiality. Now, again, I wouldn't necessarily say why I had contact with people, but I just don't want to have that risk of violating anybody's confidentiality. Annie, any other questions?
Yeah, so if we could provide some clarity on when a BAA is needed, I've seen just a lot of various questions about that.
Okay. Is Jennifer still on the line?
Jen, unfortunately.
I'm sorry.
Mm-hmm.
Annie, what was the question again? I'm sorry, I was reading questions.
So we've just had questions about when a BAA is needed. You know, some people are asking, like, is it needed from clients? Is it needed from the software you're using?
Okay.
Yeah, a BAA is a business agreement, right? Yeah.
Yep. It's a business associate agreement, and it's something that you get from any third-party vendor that you're working with that is handling PHI, so your patient health information. So that's why these HIPAA-compliant platforms that we've been discussing, they would offer a BAA that would be signed between you and them, and that would ensure confidentiality and compliance with the HIPAA regulations. And that information, we've had a couple of questions asking us to repeat the list that Pat had mentioned earlier. That information is available on our website. We can give it to you again now, but don't worry about having to remember everything. Doxy.me is a really popular one. And I know a lot of people have been using it successfully. There's been some audio issues that we've heard about. But from what we know, if you and your client uses a headset, that apparently helps with the audio issues. VSEE is one. Zoom, of course, is a very popular one. Secure Video. Jen has talked about RingCentral, Theramest. And as a reminder, several EHR platforms, the electronic health records management software companies, that if you're already using, so Simple Practice, for example, as an add-on for, I think, $10, they have a telehealth platform that you can use.
Mm-hmm. Yep.
As Pat was saying, there's been, I guess some insurance companies have their own. I know Blue Cross and Blue Shield has their Horizon Care, and they sent out some information about requiring providers to use that platform. But as Pat was saying, it's not supposed to replace therapeutic relationships with the client and the therapist. And so you can still continue to use your own platform. Again, you'd have to double check with the insurance companies. As we've heard that Aetna, I think, is the other one that might be requiring their own telehealth platform. Again, this was before COVID-19. And so it's best to just double check with the insurance companies and try to find out what telehealth platform is either required or if you're able to use your own. Also, I'm sure you can talk about this. We've been getting a lot of questions about CPT codes, coding for billing. I mean, we've talked a lot about the coding already. So 02, again, I'm just going to keep it. 02 is the place of service code that you would need to bill the insurance companies, and then a modifier, if necessary, by the insurance companies, GT or 95. But the CPT codes does not change.
Right.
Correct?
Correct.
Whatever you would be using for
Right.
an office or in person is the same.
Yes. So for example, I bill an awful lot of 90837, which is for a 53-minute psychotherapy session. So I would, I happen to use Theranos. It's the EHR I use. So the appointment would say 90837. I have a modifier in my software. It automatically does it for me. There's been rumors, what I've seen in various Facebook groups is that Blue Cross Blue Shield is allowing us to bill an 11 as opposed to a 02, because a 02 is not even a drop down on the, excuse me, on the software that Blue Cross Blue Shield is using. Different software, if you use software, the modifier is going to be in different locations. So I've seen a lot of questions about, well, where in, for example, Navinet do I put the modifier? Specifically in Navinet, the modifier is on the last page right after you do your 90837. It's the other column. It's the right-hand column at the bottom. It says modifier. You put your 95 in there. You hit submit. You keep your fingers crossed. You hope you get paid in a week or two. And again, I've submitted a few at this point, but I have not received payment yet. But I'm also not expecting payment yet because I just did it within the past few days. So hopefully pretty soon I'm going to see therapists across the state, you know, in the Facebook groups I belong to, putting, yay, I got paid. And we'll have to see how it goes from there.
Fingers crossed.
Yeah, definitely fingers crossed.
Sorry, everyone. I'm trying to spare you from the garbage men picking up my trash right now, but
well, we are very grateful for those garbage men still working.
Yes, we are. So one question I don't think we really addressed that I've just seen, because everything else I think we have, you know, at some point mentioned. And I will say we are recording this and we are going to share this recording for those of you who may have missed things, or, you know, for those who weren't able to get on. But the only thing I don't think we've covered is about group practices and group therapy and how individuals can really handle that situation, whether they're allowed to do it in person or how telehealth would work with that.
My understanding is that you still can, you can do group therapy. You are going to need a platform that will allow you to have multiple people join at once. Again, the software I use is through Theranest, and I do have the option of doing groups. I personally do not do groups, so I did not pay extra for that option. You can do it, and all the same things apply. Are the clients in a safe where they? I'm sorry. Are the clients in a space where they feel safe? Are they doing? Are they able to participate? Is the therapist able to participate at that time? How comfortable does the therapist feel? I know a number of PHPs and IOPs are now offering their services online. I do think it's going to, all of this, whether it's doing one-on-one therapy via telehealth or whether it be group, it's going to take some level of adjustment and getting used to. I kind of looked at my first week of doing it kind of like as a, let's just get through this first week, find out what works, find out what doesn't work. I've been asking all of my clients for feedback on what they would do differently, what went well, what didn't go well, how do we handle some of the bumps in the road, like the buffering or the loss of audio sometimes. You know, a lot of groups rely on paperwork, you know, like here, fill out this sheet on what stresses you out and let's talk about it. So that's going to take pre-planning on the therapist's part of, are they able to send it out? Are they allowed to send it out? Do the clients have a way of looking at it? So there's a lot of thought that goes into it. And again, truly it's going to be up to the therapist and the clients to see if this is going to be a model that works for them. Oh, and I'm sorry, one more thing about group. The therapist may, because I've taught online, so I haven't done groups online, but I've taught online. I would kind of recommend kind of doing what Annie is doing right now, which is having only 1 or 2 people be allowed to talk at once. Because if you have a group of 10 and all 10 people try chiming in at the same time, it's going to be a bit challenging. So it might take some working through and trying to figure out, again, just what works for you and how do we keep it having the best flow as possible.
Pat, I know we've gotten a couple of questions about clinical supervision, and as a clinical supervisor, I don't think many people know that with the new regulation changes that they allow up to half of clinical supervision relevant now. Do you want to take a minute to talk about that?
Sure. So yeah, with the new regs that came out, I don't think it was last year, I think it was the year before. At this point, the days and the years have all
September 17, 2018.
All right, good. All right, so September 2018 was when the new regs came out. And the only mention of teleservices in our new social work regs was about clinical supervision. And it does allow for up to half of the hours of clinical supervision to come via telehealth. But again, the regulations do require synchronous video conferencing for that supervision. So again, it must be 2 people online at the same time. You can do groups. I actually do the right now what I'm doing since the kind of the shutdown is we're doing groups online where I meet with 2 clinicians at a time, and we do it that way. You know, again, the same things about clinical supervision, having a space where you feel safe, having a space that's confidential, having people that are willing and able to actually do it. There are some rules, or at least there were some rules that now have been kind of lifted about can LSWs or LACs provide services via telehealth, and for the time being in this crisis, the answer is yes. I anticipate that going back to no once the crisis is over. So there's that with the clinical supervision. But I've also gotten a lot of questions about interns. I treat a lot of college and graduate students. I have two or three students that are getting master's degrees where they are working, either in counseling or social work or something in that world. Unfortunately, the regulating bodies, CSWE and I believe it's KCREP, are not budging on the amount of hours that an intern must have. And interns are not allowed to provide telehealth services, from my understanding. So that is one of the big areas for our students that are out there, our MSW and Masters of Counseling students, is that many of them are very upset and stressed about what to do with their internships because they are not allowed to provide telehealth services.
Not to cut us short, but we do have another webinar starting at 12, so we do need to end. But thank you so much, Pat. Everyone has given wonderful, positive feedback, and Christina as well. You guys have provided so much really useful information. We really appreciate it.
Well, thank you very much. And this has been fun. And if anybody has any questions, I guess reach out. I mean, I'm going to ask if Annie or somebody could forward me the questions, and we can also maybe put together some more answers. And I'll see everybody hopefully soon.
Absolutely. Thank you.
Thank you, everybody, for joining.
All right. Bye.